FDA crackdown on Kratom 7-OH, opioid ban looms, key updates. Imagine walking into your local gas station or convenience store, only to find energy drinks, gummies, and supplements laced with a substance that could be more potent than morphine. This is the alarming reality U.S. health officials are now addressing as they crack down on products containing 7-hydroxymitragynine, 7-OH, a chemical derived from kratom, a Southeast Asian plant. But here's where it gets controversial. While some see kratom as a natural remedy for pain, anxiety, and even opioid addiction, others argue that 7-OH, often found in concentrated synthetic forms, poses a significant risk to public health. Kratom has gained popularity in the U.S. as an alternative treatment, but its unregulated use has raised red flags. In recent months, dietary supplement companies have pushed the Food and Drug Administration, FDA, to take action against products containing 7-OH, claiming it's a dangerous synthetic derivative of the plant. The FDA has responded by clarifying that its focus is not on natural kratom leaf products, but on the risks associated with 7-OH. The agency has even recommended classifying 7-OH as a Schedule I drug, placing it alongside substances like LSD and heroin. And this is the part most people miss. The FDA's Commissioner Marty Makary emphasized, 7-OH is an opioid that can be more potent than morphine. We need regulation and public education to prevent another wave of the opioid epidemic. This statement underscores the urgency of addressing the potential dangers of 7-OH, especially as it's often marketed in products that appeal to unsuspecting consumers. The debate doesn't end there. While supplement executives like Ryan Niddle of Diversified Botanics applaud the FDA's actions, groups like the American Kratom Association have long fought against restrictions, arguing that kratom could be a safer alternative to traditional opioid painkillers. Conversely, critics like the Holistic Alternative Recovery Trust accuse kratom trade groups of deflecting blame onto 7-OH to protect their market share. This clash of perspectives highlights the complexity of regulating substances that straddle the line between natural remedy and potential health hazard. Nearly a decade ago, the federal government nearly banned kratom outright. In 2016, the Drug Enforcement Administration, DEA, planned to classify it as a Schedule I drug, but public outcry, including a letter signed by over 60 members of Congress, halted the move. Since then, the FDA has continued to study kratom, concluding in 2018 that it shares many of the same chemicals as opioids. Despite this, kratom remains unregulated at the federal level, though several states have restricted its use. The FDA's recent warnings extend beyond kratom. Last month, the agency issued letters to 7 companies selling 7-OH-infused products, citing violations for unevaluated safety claims and misleading medical treatments. Similarly, other unapproved substances like tianeptine, often dubbed gas station heroin, have come under scrutiny. While some states have restricted these drugs, federal scheduling remains a contentious issue. Here's the burning question. Is kratom a lifeline for those seeking alternatives to opioids? Or is it a wolf in sheep's clothing, posing risks that outweigh its benefits? And what role should regulation play in balancing public safety with individual choice? Share your thoughts in the comments. This debate is far from over.